Hello everyone, I am Dr. Deepu Changappa, consultant pulmonologist. Following COVID infection, many of my patients are coming back to me after a few weeks about persistent cough. So the first question they ask is, why do I still have a cough? So a cough is usually a reflex action to clear dust, phlegm and other irritants from your lungs and the windpipe. While recovering from COVID, you may continue to experience a dry cough for some time. That's a usual thing to happen. Over time, a cough can develop into a cycle where excessive coughing causes irritation and inflammation, which worsens the cough. A dry cough may have no obvious cause, and using the advice which I mentioned in the next part of the video will help you to prevent the cough. A problematic cough can also make you breathe through your mouth, which means that lots of dry, fast-flowing air enters the lungs, affecting the delicate airway membranes and further causing the cough. What exactly happens? So when you have post-COVID, you might be in anxiety, you start breathing through your mouth, and then abnormal breathing pattern takes place. Then fast-flowing dry cold air passes into the lungs. So then there is irritation of throat and lungs, then there is a tickle in the throat, then there is a bout of cough. So how can you control this? Practice a normal breathing pattern. It's a gentle, quiet, diaphragmatic nasal breathing. That is, you have to breathe gently, quietly, and you have to breathe through the nose. Whenever you breathe, observe your diaphragmatic movements. That is called as tummy breathing. Feeling the tummy rise and fall as you breathe in and out. Aim to practice this little and often. And then, once you are comfortable with this, try to practice this when you are doing any activities. There are other techniques which can also help you in reducing the cough. Close your mouth and swallow when you have a urge to cough. Then gently breathe in and out through your nose until the urge to cough goes away. Sip drinks regularly, whether it's hot or cold, it doesn't matter. And suck boiled sweets or lozenges. Using a combination of the above techniques is more effective at reducing your cough. Pick the technique which is best for you. It can be very difficult to control your cough, but keep practicing. Finally, the cough will subside and it will disappear. So this was regarding the dry cough. Now, few of my patients have a wet cough. They keep asking me, why do I have a productive cough? That is, why do I produce a sputum? So here is the reason why you have a productive cough. It's important to realize everyone produces sputum as part of the body's normal defense mechanism. It is how the lungs and airways keep themselves clear and clean. You may find your chest remains productive with phlegm following an infection and admission to a hospital. Your breathing may be noisier than normal, that is because your airways have become smaller, and you may be short of breath following a chest infection. It's important to continue to clear the secretions from your lungs. This will reduce the chances of recurrent chest infections, allow you to breathe more freely during exercise and everyday activities, and help reduce any uncontrolled coughing. The breathing exercises which I describe in the next part of the video will help you to effectively and efficiently clear your phlegm. It's important not to force clearance and make sure you give yourself plenty of time to rest during and after the exercise. So first I will explain how to do the exercise and then I will demonstrate how to practice it. Make sure you are sitting in the upright position and comfortably. Take a slow deep breath in through your nose and hold it at the top for a count of 3 if you can, or else you can just take a deep breath without holding and then start releasing it. Then let it go gently from your mouth. Repeat it 3 to 4 times. Gentle relaxed breathing for 20 to 30 seconds. And then repeat steps which I told initially, that is breathing through your nose deeply and holding breath for 3 seconds and releasing it through your mouth for 3 to 4 times. Then once again repeat the cycle of normal gentle breathing for another 20 to 30 seconds. So this can be repeated 3 to 4 times. Half 2 to 3 times. Take a slower and deeper breath through your nose, then breathe the air out quickly through your mouth, keeping your throat open as if you are blowing steam over the mirror. Repeat this for 3 to 4 cycles or until you feel that the phlegm has cleared. Sometimes you can feel dizzy with doing the cycle. Allow enough time in between to get adequate rest. Repeat this for 3 to 4 cycles or until you feel the phlegm has cleared. Sometimes you can feel dizzy with doing this cycle. Allow enough time at the breathing control parts of the cycle for your breathing to become quiet. Remember, the huffing should be short. Try not to breathe out for so long that you need to gasp for air. If the dizziness persists, then you stop this step. You may need to use this technique several times in a day. Find a time that is convenient for you to practice this. The following things can also help you with clearing the chest. Positioning, always try to keep you in an upright position. Taking prescribed medications of antibiotics and steroids. Taking your inhalers if you have them. And drink plenty of water to keep yourself hydrated. Steam inhalation twice a day for 2 minutes each. Exercise and keep active. So I'll just demonstrate how to do this huffing technique or the exercise to clear the throat. So I'll be demonstrating only one cycle, but you can repeat this 2 to 3 times. Initially, you take a breath through your nose. Hold your breath for a minimum of 5 seconds, if not 5, at least for 3 seconds, and then release your breath through your mouth as if you are whistling. Then breathe normally for 20 to 30 seconds. Once again, you repeat the deep breathing pattern, that is, breathe through your nose, hold your breath and breathe out through your mouth in a whistling pattern. Then you have to do huffing. This is how to do the huffing. So once you are done with this, then give a cough and try to bring out your sputum. So this is how it will help you in bringing out your sputum. So this is regarding the post-COVID dry cough and post-COVID wet cough, how to treat it and how to get relief from it. Hope this video has helped you a lot. If you have liked this video, please don't forget to share with your loved ones, and also don't forget to subscribe for further updates regarding COVID and other health related issues. Thank you.